Hello, my name is Vanessa Blinn, and today we're going to be talking about reducing anxiety in children in the emergency department, specifically during peripheral IV insertion. The primary non-pharmacological intervention for reducing anxiety in these children is a distraction technique. So we want to look at, for pediatric patients in the emergency department, does the use of a distraction technique truly reduce anxiety as compared with those who do not receive distractions during a peripheral IV start? Now, why does it matter if children experience anxiety during their IV start in the emergency department? It does matter because not only does it affect the child in the ER at that moment, but it can also have long-term ramifications. So in the ER at that moment, it can lead to more IV attempts. As a nurse, trying to start an IV on a child is incredibly difficult. They have multiple physical factors that affect this. They become hypovolemic a lot faster than adults. If they're there and they're dehydrated, it becomes very difficult. They typically have smaller veins, but you add to that these children become anxious. They start fighting, they're moving, they're trying to get away, they're crying, they become stressed, their parents become stressed. You have to have other nurses there to help hold them still so that you can successfully insert the IV. But it's very difficult to hold the child still while not harming them, still enough to insert the IV. And then the more people you have there and the more you hold the child, the more anxious they become. And it's just this horrible cycle. So this anxiety can lead to more IV attempts. It can also, as we just talked about, increase anxiety and pain for the patients and the parents. Pain and anxiety are very closely linked, and there are multiple theories that talk about how anxiety can exacerbate the way that we feel pain, and we'll talk about that a little later. It also threatens the core wellness of the child. If you look at the Betty Newman system model, this model talks about people as having a core of wellness that is surrounded by flexible and normal lines of defense, things that defend our well-being. Patients are made up of complex parts. So we have our mental well-being, our physical, our social, etc. So you have these children who come to the emergency department typically because their physical well-being is already being threatened, and those lines of defense are already being attacked by various stressors. Now we add to that this anxiety that comes with the IV initiation, and that the stressors start to attack the lines of defense surrounding our psychological or mental well-being as well. And so not only are they being attacked from the physical side, but now they're also being threatened from the psychological side, which is not great for the patient's health, and it can actually have long-term ramifications. We look at adults. Needle fear is reported in 2/3 of children, but also 3/5 of adults report needle fear. It can cause vaccine non-adherence, even in hospital staff, employees who understand the benefit that comes with vaccines. 27% of hospital employees cite needle fear as one of the reasons that they delay or avoid vaccine administration. Needle fear can also lead to the delay of care and non-compliance. So 52% of adults avoid necessary blood draws because they're scared of the needle. They can also lead to non-compliance in various diseases, but especially in diabetes in both adolescents and adults. Many people cite needle fear as one of the primary reasons for both not checking the blood sugar like they should and also not administering the insulin as they should. So again, not only is this a problem in the moment in the ER, but it can have long-term consequences that can still negatively affect the person's health. So this is a very significant problem. It's not surprising to find that this problem of pediatric anxiety during multiple different procedures, not just IV starts, has been noted by different healthcare providers and researchers in a variety of healthcare facilities. So we're going to take a look at 5 major articles discussing the problem of pediatric anxiety and different distraction techniques to try and help reduce this anxiety. 4 of these articles are experimental randomized control trials, and article number 2 is a quasi-experimental trial. So article number 1 talks about Ocean VR, which is virtual reality, versus roller coaster VR in decreasing pain, fear, and anxiety during pediatric blood draws. And this research study found that both Ocean VR, which is relaxing, and roller coaster VR, which is more exciting and interactive, equally, or they have no statistical significant difference between the two groups. They both, however, decrease pain, fear, and anxiety significantly more than not receiving any distraction during a blood draw. A second article compares virtual reality to watching a television during a dental procedure, a cavity repair, and they found that virtual reality is more effective than watching television in decreasing anxiety and improving behavior in these children. The third article compares watching a cartoon in virtual reality versus on a tablet versus not watching anything at all during a blood draw in the emergency department. And it found that virtual reality had the greatest effect on reducing pain, fear, and anxiety during the blood draw, followed by watching a cartoon on a tablet, which was less effective than the VR, but more effective than no distraction at all in reducing this pain, fear, and anxiety. The fourth article doesn't look at VR. It actually looks at aromatherapy and taste and their effectiveness in decreasing anxiety during radiophysiography, which is still an anxiety-inducing procedure for many children. Even though it typically should not involve any pain, it still does make children anxious to have to stand there and bite the piece that they have to bite during for this dental radiophysiography, and any movement can significantly affect the amount of x-rays that they have to have. And so they found that aromatherapy, specifically lavender, and taste, licking a lollipop during the procedure, both decreased anxiety during the radiophysiography and actually led to more clear images from this procedure. The fifth article looks at binaural beats and allowing the pediatric patient to choose their own music to listen to during a cavity repair. And if you don't know what binaural beats are, which I didn't before reading this article, but it's where you listen to two different tones in a different one in each ear, and it creates a third one in your mind. And these beats have been found to induce relaxation by producing stimulus waves that synchronize brainwave activity, and they reduce anxiety and again induce relaxation. And so they found that listening to this pre-selected music, or listening to the patient's music of choice, which gave them a sense of control and familiarity, both of these interventions reduced anxiety during the cavity repair, and there was no significant difference between the two interventions. During the cavity repair, they did use needles and drills on every single one of the children, and again, these are very anxiety-inducing instruments as well as the procedure itself. And so we find in all of these articles that there are distraction techniques that truly can aid us in reducing anxiety in these pediatric patients. Unfortunately, even though these articles did a great job of looking at these different distractions, there were still some gaps in the research. So in the literature, so we found that not a lot of these articles or articles in general look at pediatric IV starts in the emergency department. And many of us know the emergency department is kind of a world all of its own. It's very unpredictable. You don't typically know how long you're going to have with each patient, because you could have a new patient come at any time unexpectedly with an unknown acuity. The ER is not a familiar place. It's not somewhere where these children have spent many days and gotten to know the staff. You have a few minutes of interaction oftentimes with the child before the procedure starts, so it's really hard to develop that relationship of trust prior to starting the IV. So looking at procedures in the ER could significantly differ from looking at procedures in other offices or even within the hospital. I also find that there aren't a lot of studies that look at the difference in success rates of the IV starts while using a distraction. As we talked about earlier, with my experience, it is significantly more difficult to start an IV on a child who is experiencing a high level of anxiety, but the research to back this up is lacking. And so looking at that success rate could help with encouraging administration and the organization to help implement this distraction technique and just give more evidence toward why this should be implemented and utilized. The final one is the utilization of aromatherapy or taste in conjunction with things such as virtual reality. So virtual reality is suspected to be such an efficient and effective distraction technique because it engages so many senses. You're engaging your sight and your hearing and your touch. However, it's not necessarily engaging smell and taste. And so looking at potentially combining these simple distraction techniques, setting up a lavender diffuser in the room, giving them a lollipop, and having them watch something, the more senses that you engage can also decrease the amount of anxiety that you're feeling, per theory such as the gate theory, which talks about the gates that allow the pain sensation to be processed in the brain. These gates can be closed by distractions or other stimulations such as touch and those sorts of things, and anxiety goes hand in hand with that pain in this theory. And so the more senses that you engage, again hypothetically, could decrease the amount of anxiety even greater. So based on these gaps in the literature, some research needs and some of the next steps would be conducting further research specifically in the emergency department with these pediatric patients. So looking at what interventions are most efficient to use in the ER and can reasonably be used in a time frame that is allowed in the emergency department. VR is incredibly simple. You have standalone VR headsets that you just put on and turn it on. It's very quick. Aromatherapy could also be quick. There could be some complications with that if you had children with asthma who could be that could be exacerbated by different smells, but it could be a fairly fast distraction technique. Handing the child a lollipop could be fairly quick. So looking at all of these techniques in the emergency department specifically, we also need to examine those first attempt success rates when using these non-pharmacological distraction techniques to determine if it really does help improve on a statistically significant level the rate of first attempt IV success. And finally, looking at the combination of distractions to see if combining several of these distractions that activate multiple different senses could provide a greater reduction in anxiety than simply utilizing one distraction at a time. So with all of this research, there are so many different opportunities to look into reducing the anxiety that these children experience during these IV starts in the emergency department, so that we can not only reduce the issues and the emotional distress and the threat to our well-being that come in that visit, but also reducing these long-term consequences that can affect our patient's health. Thank you.